Hi everyone, my name is Ciara Mitzel and I shadowed a P4 at the Banner University Medical Center. This specific rotation was placed on the cardiac level, which tends to receive an overflow of patients where there isn't enough room on the floor where the patient necessarily should be based on their diagnosis. My P4 had expressed that this rotation was different from her other rotation, which was ambulatory care that she'd done at Banner University Medical Center. Because her ambulatory care rotation, she said her and the pharmacist were able to do rounds with the physicians and PAs, whereas the rotation on the cardiac level that I had shadowed with, the pharmacist and P4 do not go on rounds. However, while they didn't go on rounds, they were still able to sit and participate in a similar version of what the nurses go through. At the nurses' station, each nurse is responsible for specific patients, and they present their patient to the lead nurse, discuss the status of the patient, and then direct questions that they have towards the pharmacist, such as, patient X hasn't improved since the doctor prescribed this, is there anything else we can try? Or the patient's lab results come back with these INR levels, how should the dose be adjusted? Or the patient's lab culture came back with microorganism X, what's the best antibiotic used against this specific microorganism? Or other questions would be, will the new medication X affect their current medications that they are currently on? Or the patient seems to be experiencing this side effect. Is this normal for what medications they're on, or should they be switching or adding an additional medication based on this side effect? While the nurses may be in charge of specific patients, the pharmacist is in charge of all of the patients on that level because they oversee the medications for each and every one on that level. The pharmacists work collaboratively as a team, like with the nurses, but they also work independently in their office. The pharmacist receives pages and emails from several doctors, PAs, or specialists asking for them to essentially sign off on the correct medication regimen that they should be following through with based on the diagnosis that the doctor or PA or specialist has for that patient. The pharmacist typically pulls up the patient's profile with their lab work, diagnosis, medical history, and current medical regimen, and then bases her conclusion of what the patient should be started on to decrease it, increase, or discontinue altogether. The pharmacist's role as a whole is to make sure it's the right medication based on the diagnosis, as well as the right medication based on any other drug-drug interactions. The P4's role during the shadowing was to confirm newly admitted patients' medications. They were the ones that had to go to the charts, and then based on the charts, they had to compare to what the patient told them, what the pharmacy has on file, call mail order pharmacies, and also call other family members. Then based on that, they had to decipher, based on the base judgment, what the current list of medications are for the patient. And after confirming the medications, they had to go back into the patient chart online and edit them and make them correct if there was any errors that had been previously entered by the nurses. Several challenges faced the P4 based on the aspect of language barrier. When speaking with the patient that was newly admitted, if they did not speak English and there was no translator, or some patients that had dementia, they weren't able to remember what medications they had taken. Or another challenge could be that that patient doesn't have any family, or they didn't even have a spouse. After confirming the medications, the P4 had a list of patients' charts that they would have to go through and make medication recommendations to the pharmacist, who then would page the doctor or PA to make their recommendation too. Overall, I enjoyed this rotation because it wasn't an extremely high-paced department like some can be. I thought I learned a lot just in 4 hours shadowing by helping the P4 and going through patient profiles together and making medication recommendations, then seeing the pharmacist agree and telling us, oh, nice catch, that's a great recommendation, and then they would page the doctor, which made me feel like I actually contributed and helped the patient even though I was indirectly without ever communicating with the patient. I also really enjoyed the aspect of the pharmacist isn't consistently working as a team member or independently for 100% of the time. They are jumping back and forth between working independently and collaboratively, which suits the type of person I am. I don't want to do just one or the other. The only hesitation wanting to work in this setting is the pharmacist said she had to do a 2-year residency, and going to school for an extra 2 years isn't something I'm sure I'm willing to do right now.